Thinking about these feelings got me in my feelings, but I'ma be alright. Thinking about these feelings got me in my feelings.
Hey, well, welcome to the NJPA's Power of the Spoken Word podcast series. This is a place where you can find all the information on topics related to psychologists and psychology in the state of New Jersey. Our podcasts are set up as a resource for everyone who lives, loves, works, and plays in New Jersey. This is our second podcast actually, and I guess once I get to the third, I'll stop counting. So we want to welcome everyone, and today we're going to be talking about COVID, but we really want to talk about it in everyday language for the public because there's a lot of information and misinformation, but we also want to integrate some strategies. So I want to introduce our guest. So our first guest is Dr. Jamie Feldman. She's a licensed psychologist who has been in private practice for over 25 years, providing therapy to children, teens, and adults. Anxiety, self-confidence, and relationship issues are her most common treatment needs. She also enjoys making media appearances and creating inspirational posts. In her spare time, Dr. Jamie enjoys running, Zumba, and fostering rescue dogs. She has fostered well over 100 unwanted dogs and puppies until adoption, but has adopted only 2. So we thank you for your kind service. I can't run the same joke twice. So the next the next guest is Dr. Pat Pryor. And she is an associate medical director at Rutgers University Camden Student Wellness Center. She is involved with the New Jersey College Health Association, American College Health Association, and the International Society of Travel Medicine. She enjoys lap swimming and swims more than 50 miles in the summer without using any vacation. So I had to get that. And then last but not least is Dr. William Walsh. He's a psychologist in private practice in Metuchen, New Jersey. Dr. Walsh has over 40 years of experience in the treatment of anxiety and stress in children, teens, and their families. Now, his anecdote is really deep, so I'm going to take my time to work through it. So he trained in Geneva, Switzerland as a visiting graduate student at Piaget's Institute of Genetic Epistemology. He was initially, he reported like being initially out of his depth linguistically. His high school French, he said, was less than rudimentary. And he said when he went to a bakery early on, he ordered some pastries. The server asked if he wanted them bien cuit. Assuming that phrase meant well done, he said sure, but thought it was strange that pastries were served well done in Geneva. Opening the bag at home, he found the pastries were burnt. And he said 2 lessons that were learned. Bien cuit means burnt, and Swiss bakers sold burnt products at full price. And here's the part that I really love. He said by the end of his studies, he said a group of students and faculty told him that he lost his American accent. But he started to speak with what they said was a Polish one. So, and like I mentioned, the reason we wanted to take time to do the fun facts was really to get us connected first from a very social and emotional space. And that's one of the biggest challenges people are saying they're missing in this day. And we're wired to be amused and entertained and engaged. So one of the things that we've been talking about is sort of the impact of COVID-19 and exactly what it is, because there has been a lot of misinformation and miscommunication. So we want to start off with Dr. Pryor to see if she can just give us a brief primer on what's the most accurate facts about COVID.
Okay, so the whirlwind tour. We're all somewhat familiar with the outbreak of COVID-19. The understanding for the virus is an ongoing process, and it's a very changing environment. So this is what's current only. COVID-19 is an RNA coronavirus. There are actually several coronaviruses that are usually found circulating, and they cause normal cold or upper respiratory infections. COVID-19 is thought to be more contagious than our seasonal flu. And it's spread by respiratory droplets. So when you cough or sneeze in the air, and it lands on surfaces as well. There have been a study done where they looked at how long the virus will last on surfaces, and it appears to last up to 24 hours on cardboard, and copper 4 hours, and plastic and stainless steel for up to 3 days. There are also several studies that have looked at the spread of COVID-19 in asymptomatic and pre-symptomatic people. It's thought it may be contagious for a day or two before you develop symptoms. And the symptoms, as defined by the CDC, associated with COVID-19 are fever, cough, shortness of breath, chills, which may be recurrent, muscle pain, headache, sore throat, and new loss of taste or smell. Some other symptoms that others experience are diarrhea or change in mental status in elderly. The management of the disease includes testing, self-isolation, contact tracing, and hospitalization as needed. The testing for COVID-19 is a reverse transcription polymerase chain reaction, big word, where there's a nasopharyngeal swab, usually, or sometimes a throat swab, that are done by a medical provider. They can take several days to get results. There are now saliva tests that have been done by Rutgers University is one of the sites that developed this, and also the military. These tests are self-administered, and there's a quicker turnaround time, and they are also not a risk to healthcare providers. No one needs to perform it. There are also antibody tests to COVID-19, and when they've looked at the prevalent populations where there's been outbreaks, like in California, it showed that there was just under 5% of the population had antibodies to the virus. But in New York City, it was about 15% of the population. What's unclear is how long this immunity will last, and who should be tested. So the priority right now is to healthcare workers and first responders and hospitalized patients, and then people who have a higher risk of complications. After this, it's recommended by the doctor, but there aren't, it's still limited testing, although the New Jersey Department of Health has a site where you can look at where the testing sites are in New Jersey. Okay. It's estimated that 80% of those infected all have mild disease. And so it's just symptomatic treatment, rest, hydration, avoiding contact with others, avoiding sharing plates, drinks, towels, bedding, and if you can, use a separate bathroom. And then watching for any signs of worsening disease. In those with severe illness, COVID-19 can affect all organs, your lungs, your heart, your kidneys, your vascular system. It's a risk of blood clots and including risk of strokes. The risk factors for severe disease are if you're older than 65, you have immune system disorders, heart disease, diabetes, kidney disease, obesity, liver disease, and it's seen in the homeless and incarcerated. The medications currently being evaluated, studied for COVID-19 have been previously approved for other purposes. There are antivirals, immune modulators, interleukins, hydroxychloroquine, which we all here know about, and convalescent serum from people who have previously been infected with COVID-19. There are several vaccines that are currently under investigation, and but they're a year to 18 months till it's developed. So to protect yourself, wash your hands all the time. And if not, use a hand sanitizer greater than 60% alcohol. Avoid contact with anyone ill. Clean and disinfect surfaces, frequently touch surfaces, and wear a mask when you're out. It's required in New Jersey and Pennsylvania when in social settings, when you can't social distance more than 6 feet. Shopping, pharmacies, living in a city. It protects you, it protects other people from you, and it will, enhance your sense of community with others doing the same thing. Don't touch your face and don't go out if you feel unwell.
Mm-hmm. Thank you. And I want to touch base on, because in listening to sort of the medical consequences, we want to really focus also on the psychological consequences. And I know you mentioned how wearing a mask sort of builds community, and a lot of people are thinking how COVID-19 is taking that away from us. So, with Dr. Walsh, could you talk about some of the issues that you sort of observed or kind of been thinking about in terms of the consequences of COVID management, like the psychological care?
Sure. Uh, the main consequence I've been thinking about is the management of anxiety in
Mm-hmm.
both parents, caregivers, and children and teens. And for instance, with masks, I wouldn't be surprised if a few of the self-conscious teenagers are a little reluctant to wear their masks,
Mm-hmm.
or perhaps are engaging in a bit of denial because I can't get sick, and I'm impervious, and I'm above this, and all of that. So I think managing those kinds of reactions, whether they're denial reactions or catastrophic reactions, overreactions, is very important. And I think helping parents be able to recognize them is a valuable tool too. Recognize them in themselves as well as in the children.
I like that. And Dr. Feldman, what thoughts do you have?
Well, I think it's really interesting that we've adopted a term, social distancing, and I've seen others endorse an idea of physical distancing because
Wow.
socially and emotionally. And so if we can let go of that idea, I think that in of itself is also off-putting and troubling. I can't be social. And yes, Dr. Walsh, in terms of the teenagers, I see teenagers being defined. I've also seen older people not follow the regulations and put themselves and their loved ones in danger. And so with the community at large, we have a responsibility to ourselves, we have responsibility to our family, but there's a bigger social responsibility that I think is just hard for some people to embrace for whatever reason. And I think all of this creates more anxiety and more distress as we stay at home waiting and watching and looking to leadership for answers and plans and strategies and waiting for the medical research to bring us that testing and the vaccines and hopefully cures.
And that's a good point because it sort of gets me into sort of the fundamental conflicts people are experiencing during the pandemic. And some people are dealing with issues of acceptance and grief, and that's like a real just it being in the space we're in, and then the grief related to the loss of income, family members, loved ones. It's kind of like all over the place. Then it's also the loss of structure and routines and transition, and how a lot of those things, and which leads to helplessness. And one of the things that I was thinking about is what sort of advice would you give to sort of people, everyday sort of folks who are struggling with the negative emotions or reactions that are associated with that? So I'm gonna start with you again, Dr. Phil.
Well, thank you. I think when we're faced with this, it's really important to have a structure in our days and to find moments in the days of connection and positivity and feeling good. So how do we feel good? It's through good self-care and living healthy, eating healthy, getting good rest, connecting to others. Yes, if you've got a pet your pet because that'll release some good chemicals in us called oxytocin, and it also works for the dogs too and the cats, that the same chemicals we experience in physical contact, they will as well. And in terms of just everyday stuff, if you can find pockets of, I'm going to borrow a colleague's message, pockets of positivity, just moments where you can say, all right, there's something good going on here. I've enjoyed, even though I'm worried about my job and finances and health and everything. Look, I get to spend more time with my family. There's a positive here. So searching for those positives and holding on to them is really important. And just being able to connect with other people, the ones you're living with, or if you can reach out through the internet or a phone, or even sending a letter. Any way you can will be very well received and positive for both of you.
Okay. Dr. Walsh, what thoughts do you have?
Well, just mainly that social distancing or physical distancing, whatever we want to call it, is effective. I think it's a life-saving action, and it's empowering when we use it. So we don't have to feel helpless if we engage in the practices that the CDC recommends. Hand washing, Dr. Pryor was talking about before, is extraordinarily effective. It doesn't just wash away the COVID virus, it actually destroys it. You're not wiping it away, you're wiping it out. Recognize what you're doing at that point, and it's a very valuable activity. You're protecting people in your own home, usually by hand washing. That's a wonderful thing to do. I think getting back to teenagers and children, to help engage them in these practices, it might be beneficial if they personalize, think about, imagine whose lives they're saving. Whether it's a grandparent's life, whether it's their own life, whether it's a friend's life, that sort of thing, so that they become a little more involved in it. And then to manage them and encourage them to practice these life-saving gestures in the home, around the home, and when they go out.
Okay, cool. That was great. Dr. Pryor, what are your thoughts?
I think I agree with that. I think it's important. I think the people who I think this has been hardest for, I think everyone, it's difficult. I agree with that, like being in a different situation. But I think the other, and getting out and connecting as much as you can with family. I have a family member who is immune suppressed, and they have a screen that pulls down on their door, and he's been more than 6 feet back, and I've dropped off plants for them and things like that, and I'll talk to them, but we're so far away. But it has to be but at least we can make some connection. But I think that's important. If you can connect somehow, however you do it, on a phone I haven't talked to my family members so often as I am now, which is really good. I think it's important. So I think that's an important point, is whatever connections you can make are important, and not to be isolated. And I think the people who need it the most are the ones who are most isolated, but they need it the most, for the elderly and the immune suppressed people. So
I agree, and I think that even piggybacks on some thoughts around the level of uncertainty that we're dealing with at this point, which is unprecedented. And one of the things, and just to kind of go over some of the updates in the last few days, because I think Dr. Pryor, you mentioned earlier, is constantly moving, is that right now in New Jersey, there's about over 113,000 people are tested positive. We have over 6,400 deaths in New Jersey. The governor actually enacted some legislation to start tracking demographics to address the disproportionate number of people of color who are dying from it. We've talked about how it's moving southward in New Jersey. So, everybody in my mind, I'm well, what does that mean and what would that look like? And so for me, just kind of saying that, it kind of speaks to the level of uncertainty in terms of and how rapidly things are changing. So I'm thinking, what tips would you have? And I'm focused with Dr. Walsh and Dr. Feldman. What tips would you have to help people constantly navigate this complex information process, and one that's rapidly changing? So, Dr. Walsh, I'll start with you first.
Well, I think we just have to accept that there's a lot of uncertainty, and we have to try our best to learn to live with it rather than expect a pattern and a regularity in our lives. We have to come to terms with the fact that things are really quite different. I think to some degree people were getting used to the CDC regulations and adhering to them. I'm really impressed with the degree to which people have cooperated rather than resisted. But now that we're talking about opening up, it's not just that the COVID is moving, let's say, south, as you mentioned, Dr. Lee, but also we're opening up our society. There's a lot of talk about opening it up and how that's going to happen. So that's another uncertainty that we just have to get used to, when and how to engage in that. And I think individuals will probably respond to that in some of their own terms. Some might accept the opening up and some may not accept the opening up. Some may look forward to it and some may say it's rather frightening and scary. I'm not sure if we're ready for it yet.
That's true.
What
Hmm.
just to be brief, I guess, to just accept uncertainty, to be aware that it's around, and to help children and teens deal with it as well.
I agree with that. And Dr. Feldman, what are your thoughts?
Well, I think in terms of coping, we need to build skills and resilience. So finding the strength within us in terms of what we've lived through and conquered in our own lives can be helpful, reflecting on that. Looking to support from others, whether they're people we're living with or friends or family or professionals. Taking advantage of online resources and looking to to establish connections and find ways of coping so that we're feeling strong and secure and focusing on positives. Those are strengths that we can all build and doing things to support that. So it feels good to accomplish. It feels good to help other people. It feels good to get things done. So doing things like that that feel good can also be very empowering.
And, you know, really, Dr. Walsh, you sort of got us on to sort of the next area that we were going to think about, which is transitioning into this new normal. Like it's all of these recovery roadmaps in terms of reopening. In New Jersey, Governor Murphy kind of integrated or communicated 6 principles from that roadmap, which is sustained reduction in cases, expand test capacity, robust contact tracing, safe and secure places for isolation and quarantine, responsible economic restart, and ensure New Jersey's resiliency, which, you know, Dr. Feldman really alluded to. And I'm thinking, you know, that process, you know, that transition, the idea that we have to think about this new normal is going to create some anxiety and some stress and some tension. So, Dr. Walsh, I'm particularly wanting to see if you could talk to us. And I know you wrote about some points about an authoritative parenting role model, you know, in terms of how important and what role should that play out as we're working through this transition process?
Well, what I'd like to point out just a bit first before I mention authoritative parenting is just the value of managing anxiety. I mean, certainly we should point out that maybe we have that some anxieties already, it's normal, but if it becomes excessive, it can interfere with daily life, and with students, with children, it can interfere with their education. It's already using remote learning is already probably corrupting the education of children. Mayor de Blasio was on the TV this morning or the radio saying that the grades for high school students in New York will not be counted in the fourth marking period unless they want to be.
Right. Pass or fail,
so
right?
We see that education, remote education, is not all that it's cranked up to be. Now, but we want to be able to get the most out of it, and so managing anxiety would help to do that. Also, managing anxiety helps children to avoid some of the physiological impact of anxiety, the headaches, the stomach aches, the nail biting, the skin picking, the diet problems that they have, the sleep disturbance that they have. So there are good reasons for managing anxiety, and the authoritative parent, now that's where that comes in for me, Dr. Lee. The authoritative parent is really well prepared to do that. And coming to Dr. Feldman's point, the authoritative parent is going to use the resources that are available to him or her today, and that sort of thing. And some of those resources for children, or for managing anxiety in teenagers, adults, and others, would include sort of helping kids to restructure some of their thoughts and feelings, to actually listen to children and teenagers talk about their fears and worries. Authoritative parents are going to set a good example, but they're going to also listen to their children. They're going to try to understand the child's point of view. They're not going to just impose their own on the child. And authoritative parents will, sort of encourage their children to relax, and teach them how to relax. So we all tell people, okay, settle down, take a breath. Well, what kind of breath should you take? Not all breaths are relaxing breaths. When I was in the military, they told me, pull in your stomach, stick out your chest, soldier. That's not a relaxing breath. That's going to get you ready to be vigilant. That's what the Army wants. The relaxing breath is a diaphragmatic breath.
Mhm.
And so you've got to let your stomach muscles expand as you breathe in, exhaling out rather slowly. That enables the body to change itself. It sends a message to the limbic system that you're safe. It's a very biologically based approach, using behavior to influence the brain and the rest of the body. It's all an interactive process. Sounds simple, but breathing is a very important factor. I recommend taking belly breath breaks throughout the day so that you're relaxing and also loosening the muscles is very important. You take diaphragmatic breaths, loosen your hands, let your hands open. When we're anxious, what happens to our hands? They clench. It's just a demonstration of what's going on throughout the body. Muscles are tightening up. So if we want to unwind and relax, we've got to do the opposite of what the body does naturally when it's preparing for danger. Upper respiratory breathing comes into play, tightening of muscles. So we drop the breathing diaphragmatically. We relax the muscles. You can use relaxation imagery. Think of something very pleasant in your day. Think of something very pleasant in the past. Think of something in the future that you'd like to do once we're past the COVID. Relax, breathe into that. And parents can encourage their children to do it. They need to set the example by doing it too frequently around the house.
I agree, and those are really great strategies. And it sort of gets me to a point, sort of a next thought. We're looking ahead, and I'm going to start with you with this, Dr. Pryor. Given the fact that we are looking at this possible relaxation and I'm going to say physical distancing, because I like that point, Dr. Feldman. What should people be thinking about in terms of things to be aware of? So if you could think about 1 or 2 points that people should be aware of as we're starting to relax these policies.
So it will be a gradual process, so that there will still be the physical distancing, there will still be some of the restrictions in place as things slowly open up. So I think that so it's not going to be a night and day thing. And I think that the more you can protect yourself and feel good about yourself, the more positive it can be. And like I said, we are involved in, making plans about what to do. And everyone's involved in, all the medical staff and creatively thinking of ways to slowly, allow us to see more patients that we haven't been seeing, for physicals and for normal routine care things. But how that's going to work, so you have to look at how each business and each location this will work for you. So it's going to be a slow process, so it's not going to be, and you have to just allow that to take time. If it's not slow, then there's the risk of, increase with disease again. Right. So, so you have to just feel like, okay, well, I can take this slowly and, as long as it's moving in the right direction. Right. So.
That's good. And Dr. Feldman, psychologically or emotionally, what would you be telling people to think about as we walk through this transition?
Well, I think now and going forward, some essential things, and I think both Dr. Walsh and Dr. Pryor have given outstanding ideas here. What I'd add to that are 2 things. One, having a sense of control in this time of things where we're feeling not so in control is really important. So think about in any day, what do you have control over? And focus on that. Even journal it. That will help you. And speaking of journaling is an excellent tool for getting the clutter that's in your mind and putting it out. So therapy is helpful because in many ways, but one of the ways in releasing what's inside. And so your own personal therapy can just be journaling thoughts and ideas and getting them out. And, processing your feelings is so important because when they're inside and they're bottled up, which is my point number 2, bottled up, they wreak havoc on the inside and they cause physical problems and aches and pains and accelerated heart rate. And I'm seeing with the elevated anxiety, a lot of people having physical symptoms. And we need to remember that the mind and the body are one. There's no separation. So if you take care of your body, it's going to help your mind. And if you relax your mind, it's going to improve your body. So we're all one. And in taking care of ourselves and thinking in terms of how we can maintain control, how we can feel safe, how we can feel connected, is going to help us to cope and to function so much better and bring down that anxiety so the stress goes away. And yes, finding ways to relax, whether it's the deep breathing that Dr. Walsh was recommending, or watching something that makes us laugh, or going out for a walk outdoors, or loving our furry friends, finding ways to feel good, take care of ourselves. I think those are the ways to get through during these times.
Okay, and as we close, I wanted to have everybody think about what is your go-to resource you would want to let people, whether it's a parent, the public, children, teens, to know. So if you could give me, if people wanted to go for more information, quickly, where would you send people? So Dr. Walsh, I'm going to start with you.
I've been using the CDC very readily, and so I would recommend anything Dr. Fauci says is pretty accurate. Dr. Bricks as well. I think it's very important to look to experts in the field and not to listen too much to people who are pretending to be experts. Even some in our own field have tried that, and it's out there, misspoken on occasion. So I would go with the tried and true experts and rely and derive confidence from them.
Okay, thank you. Dr. Pryor?
Well, I agree with the CDC. They have a lot of information for the general public. The New Jersey Department of Health also does, and then I also use the NIH, and Johns Hopkins has a good map that shows exactly where in the United States and what counties and things like that. And you can look at the incidence of disease there too. So those are my go-tos, as well as other people, referring other people.
Thank you. And Dr. Feldman?
I agree with everything Drs. Walsh and Pryor have shared, especially the CDC and the NIH for information. Go to the source, not the commentators, but the source, and you'll always find the facts in that way. And in terms of coping, my go-to is a favorite app of mine called Calm, which has a daily meditation of only a few minutes, 10 minutes at most, and a huge library of wonderful resources to help people relax. Even if you don't fully subscribe to the idea of meditation, just following along the apps will make it easy and doable, and you can't go wrong with it. There's no way to really do it wrong. So just take a look. And I also find great comfort in certain social medias. I look for sources of inspiration and support, and in putting some of my own messages out there, I just find focusing on the positives and getting inspiration from other people can be really very uplifting in times of uncertainty, and it's always good to find ways to laugh and connect. So
I agree with that. And I would just add, in terms of my go-to, I would put out New Jersey Psychological Association. The website has information for the public as well as practitioners. And you will actually see two articles from some of our guests, Dr. Feldman and Dr. Walsh. They have information that we published for the public in terms of managing anxiety related to it. And I would be remiss if I didn't talk about my other go-to resources back. So we talked about this earlier about, and Dr. Pryor, you said it best, only use disinfected when? not on or in your body. So we better make sure that, given the spike in calls to the poison control lines, that we just put that out there. So again, I know it's funny, but it's funny.
I know.
So again, I want to thank everybody for joining us today, and we look forward to getting this information out. This was great, and I do appreciate your patience in terms of all the tech and glitch issues, but I think it really turned out well. So thanks again, and I'll make sure you guys get the links as soon as they're ready. So thank you.
Thank you, Dr.
Okay.
Disclaimer. This podcast is intended to provide members of the general public with access to information regarding the potential benefits of psychological treatment. This podcast is not intended as a referral service, an advertisement of services, or a solicitation of business. and is not intended to create a psychologist-patient relationship between any of the podcast participants and the listener. Any individual status as a participant on this podcast does not suggest recommendation of any such individual as a provider of services by NJPA or its affiliates. Thank you for listening to the NJPA Power of the Spoken podcast series. Remember that psychologists can provide meaningful insights to improve our understanding of things that matter in life. As experts in human emotions, behavior, and functioning, psychologists work with you to bring you the positive changes you want in your life. Be sure to visit the NJPA website at www.psychologynj.org and follow NJPA on Facebook, Twitter, Instagram, and LinkedIn.
Thinking about these feelings got me in my feelings, but I'ma be alright.